July is UV Safety Awareness Month, which is fitting as we head into the peak of summer. The UV rays from the sun are the leading cause of skin cancer. And in today's Your Healthy Family, Fox 4 anchor Lisa Greenberg is at the Fort Myers Beach to talk about the treatment options if you're diagnosed with skin cancer.
Guys, if you are someone who just likes to bask in the rays of the sun, maybe you're a sun worshiper. I know a lot of us here in Southwest Florida are. We come to the beach, we kick back, we relax, we enjoy the view. Keep in mind the harmful UV rays from the sun are dangerous and they're the leading cause of skin cancer. So when so many of us come to the beach, especially during the months of July and August, the summertime, to hit the waves and cool off, it is so important to keep in mind. If you're someone who maybe came here to the beach a lot as a child and you didn't put on a lot of sunscreen, you need to start paying attention to the signs and symptoms of skin cancer. And if you notice something suspicious, you go to a doctor and they do decide that it is something that needs to be looked at. What happens next? I'm walking you through that. I talked to a dermatologist. Take a listen.
Okay.
Fox 4 photographer Kevin Smith has had 9 skin cancer procedures.
Squamous, basal,
and most recently, melanoma. He gets regular skin checks with his dermatologist.
It was twice a year. Now, since with the melanoma, I've got to go every 3 months.
And if you go in for a skin check and the doctor finds something suspicious, Dr. Gregory Hauk with Hauk Dermatology says the first step is a biopsy,
which is a sample of that particular lesion. And we'll send it to a dermatopathologist, which is a pathologist trained in skin disease, and they will evaluate that lesion under the microscope and give us a diagnosis.
If they determine the lesion to be precancerous, it's usually treated without surgery. Kevin says he's had chemotherapy creams or blue lights used on him. But if it is cancer,
usually surgery, a skin excision, and a lot of times we'll do what's called a Mohs slide. Check the margins of that skin cancer at the same time. Make sure we clear that tumor and then repair that defect.
He says they treat the 2 most common forms of skin cancer, basal cell carcinoma and squamous cell carcinoma, every single day. And while the surgeries themselves aren't too painful, Kevin says it's the afterward that's hard to deal with, especially when he had squamous cell right on his lower eyelid.
With my eye, I was out of work for 2 months because I couldn't put my eye in a viewfinder, couldn't be outside.
Melanoma is the most deadly form of skin cancer, so it's much more serious. When Kevin had melanoma on his calf, doctors had to remove a large chunk of his skin to completely clear the cancer.
And eventually, when I get to the clean skin, they're done. This one right here took 8 rounds. I call them innings. They had to do 8 rounds to cut all that out.
Now, sometimes when you are diagnosed with skin cancer, they'll check the lymph nodes nearby where that lesion is just to make sure that that skin cancer hasn't spread to those lymph nodes. Sometimes those require further evaluation as well. Now, as we are in the last few weeks of summer before the kiddos head back to school, or we're in this time period where we are coming to the beach, taking advantage of the water and spending time in the sunshine, these are all important things to keep in mind, especially skin cancer prevention. Wearing the proper clothing, the UV protective clothing, the hats, the sunscreen. I have all the information on that, plus the signs to look out for when you go to fox4now.com/yourhealthyfamily. Please, if you take any advice from today, wear your sunscreen. For Your Healthy Family, I'm Lisa Greenberg.